My name's Holly Holder. I'm a Fellow in Health Policy at the Nuffield Trust, which is an independent research organisation based in London, in England. The research that I am presenting at EHMA is about clinical commissioning groups and their journey over the past year since they had statutory responsibility as part of the Health and Social Care Act 2013. The research is a joint piece of research with the King's Fund. We are following a selection of case studies, 6 case study CCG sites, and we are doing interviews and surveys with them. We've just finished our second year of research, and we've been following up with them most recently about what's happened over the past year. The 2 research questions that we are focusing on, first of all, what's the relationship been between the GPs and the governing body? So CCGs are supposed to be a collective organisation, a membership organisation where the members all feed into the decisions that are made by the CCG. So how involved are the GPs actually in the decisions that are being made by the CCG governing body? The second research question that we have is thinking about CCGs and their role in primary care development, supporting improvements to primary care, which isn't their primary function. CCG's primary function is to commission care services for secondary care and some other large areas, but they are supposed to be working with one of the national organisations, NHS England, to be supporting them in their duty to improve primary care. And what we've seen over the last year is that CCGs are becoming more and more involved in primary care. So how do you impact secondary care without also working with GPs to change referral patterns or prescribing patterns, and what does that mean for the budgets? And so it's very interesting and particularly topical as well, because what does that mean for relationships between GPs? So the governing bodies of CCGs are elected, NHS managers working with elected GPs. So what does that mean for relationships if you have these elected GPs who are then slightly performance managing in some ways their fellow colleagues? What impact does that have on engagement and involvement with the CCG? And also because of this relationship between CCGs and this national body, NHS England, and there's lots of discussions going on in England at the moment about co-commissioning and what this might mean if there's a change of government. So some of these questions we'll have to wait and see what happens with the elections coming up next year. As for our findings, what we found when we spoke to people this year, so CCGs have been in operation formally for a year, although they have been kind of establishing their plans and electing members and things like that prior to April 2013. The main thing that we found was that CCGs have maintained broad levels of engagement, so the GPs in their area are broadly at the same level of engagement, which is a really positive sign. However, those who are highly engaged, many of these we think will be actually leaders, the percentage of those that are highly engaged has dropped, and that's a statistically significant change. So what this slightly flags up are the pressures which GPs are under. And some of the questions we also asked them about for the leaders: do you feel as though you've got enough time to be doing this work properly? Do you feel as though the decisions you're making are fully evidenced, that you've had enough time to be able to put into really thinking through whether or not these decisions are evidence-based and whether in the best interests, the best decision that you can make? And the answers that we're getting is no, that actually they do need a bit more time. They're not sure if they've had enough support and training. So some kind of question marks coming up for CCGs about future sustainability and the retention and recruitment of future leaders of CCGs. The other most interesting result that we found is that GPs themselves do see CCGs as having an increasingly legitimate role in trying to influence their behaviour, and that's particularly around referral patterns and prescription. So compared to last year, increasing numbers of GPs think it's okay that the CCG is trying to influence their behaviour on those things, which is also positive news. CCGs were also seen by GPs as having the most influence over their work followed by the Department of Health, followed by a couple of regulatory bodies, and then followed by NHS England, who actually are the organisation that hold the GP contract. So that's interesting in terms of visibility and who GPs are actually having the most contact with. And so to conclude, we think that CCGs need to put some thought into how to maintain engagement across their organisation at all levels, so everyday GPs, but also those who have taken roles. Maybe they are the practice representative, maybe they are on the governing body, ensuring people have the time to maintain this enthusiasm and commitment that a lot of GPs do want to give to the CCG. And also to make sure that there's enough training that goes into making sure that CCGs can do the best possible job.